Good evening, everyone. Welcome to Interior Heroes. My name is Danilo Varkey Praveen, and I'm a fifth grader from St. P.F. Petricino School, Mississauga. I will be your MC for today's webinar. On behalf of Ontario Heroes, I would like to welcome everyone to the webinar on congestive heart failure and diabetes. Ontario Heroes Health and Social Services is a volunteer-based non-profit organization. Ontario Heroes has more than 120 volunteers from diverse professional backgrounds from across Ontario, like doctors, nurses, nurse practitioners, social workers, and many more. If you would like to volunteer with Ontario Heroes, please go to Ontario Heroes website and submit the volunteer application form. Ontario Heroes supports various types of communities and organizes monthly webinars on different topics to raise awareness as part of community giving. Let me take this opportunity to introduce Ms. Chris Varughese, the speaker of today's webinar. Ms. Chris Varughese is a well-known nurse practitioner and a chronic disease management specialist at William Osler Health System Brampton. She became a registered nurse in 2007 and completed her master's in 2015, which is when she became a nurse practitioner. She worked at Osler in critical care unit as a registered nurse and then in the emergency department as a nurse practitioner. Currently, she works at the complex medicine clinic at Peel Memorial Center, where she manages patients with multiple chronic diseases. She is the director of Ontario Heroes Health and Health Services. It is her passion to raise awareness about chronic conditions. Welcome, Ms. Chris Varughese. Dr. Sandeep is our moderator for today's webinar. Dr. Sandeep completed his MBBS from AIMS, Kochi, India. He did 6 months residency in human psychology in AIMS and 3 years residency in critical care and emergency medicine at Astor Medicity. He immigrated to Canada for higher studies and completed his PGDM in International Healthcare from St. Lawrence College, Kingston. He is a member of the International Student Support Team and a volunteer of Ontario Heroes International Student Parents Helpline. Currently, he works as a quarantine advisor to the Sheraton Group. Welcome, Dr. Sandeep, to the webinar. Over to you. The floor is yours.
Thank you, Danny. Good evening, all. That was such a sweet and cute intro to all of us. I really appreciate all the members who have joined this session today, finding time to attend this wonderful topics. I'm here to just give you some basic ground rules. Let's all mute till the session is done. And we have a platform for question and answers. So kindly share your questions in the chat box. And at the end of the session, I'm sure that Chris has answered to all your questions. Diabetes and congestive heart failure, two very important sessions that has to be understood by almost all of us. It's an anticipated disease which we can find in a normal human being at this point of time with the food and exercise habits. So let's not just go further on that. Let's hand it over to Chris. Over to you, Chris.
Thank you so much, Sandeep. And yes, Danny, that was the most cutest introduction I've ever had. So kudos to you for doing a great job. So I'm just going to share my screen here. 1 second. Okay, so everyone can see the screen okay? We're good?
Yes.
Okay, all right. So diabetes and congestive heart failure. So we're going to focus on these two conditions today. Obviously, chronic disease is a vast array of conditions. So diabetes and congestive heart failure are one of the most common conditions that we see, and it's very important. So we will focus on these two for today, and then maybe later on, when Ontario Heroes have further webinars, we'll be able to focus on the other conditions, okay? So just a brief disclaimer that, again, as I mentioned, the disclaimer is that the information is just purely educational and informational. It's very broad, so it's not limited to today's content in the presentation. So it's not meant to be medical advice. If medical advice is required, then I encourage you guys to consult with your family doc or a nurse practitioner, okay? So what are chronic diseases? Chronic diseases commonly have a long duration and they progress slowly. They have an impact on quality of life and they require ongoing medical care. Many chronic diseases are preventable, yet they're the leading cause of death in Ontario. Cancers, cardiovascular diseases, chronic lower respiratory diseases, and diabetes are the most common causes of chronic diseases in Ontario. Tobacco smoking, exceeding recommended limits for alcohol consumption, physical inactivity, and unhealthy eating are the main modifiable risk factors for chronic diseases. So if you look at the causes of death in Ontario, so it's the 2015 data that they have. So if you look at it, 74.2% of the reasons for death in Ontario is because of chronic diseases. And these are conditions that could be prevented. And if we look further into the chronic diseases, 40% are due to cancer, 36% of it is due to cardiovascular disease, diabetes is 3.7%, chronic lower respiratory disease is 6%, and other chronic diseases are 14.3%. So if you look at it, it is a huge impact and burden on our healthcare system. So the more you know about these conditions, the more you can do for yourself and help prevent these conditions. So what is diabetes? So your pancreas, they produce a hormone called insulin. So when your body can produce insulin or properly use insulin, the sugar builds up in the bloodstream and you develop diabetes, which then becomes a lifelong condition. So insulin regulates the amount of glucose in the blood to ensure that the body functions properly. Too much blood sugar can cause damage to organs, blood vessels, and nerves. Anyone over the age of 40 should be tested for diabetes every 3 years. So if you have one or more risk factors, then you should be tested earlier than that and more frequently. So you get diagnosed with diabetes if you have a fasting blood sugar that is equal or greater than 7, a random blood sugar that's equal or greater than 11.1, or if you have an A1C marker that is greater or equal to 6.5%. So how you prevent diabetes? 1, you eat healthy. A good first step is to cut out highly processed foods, refined grains such as white bread, sugary food, and sugary drinks. Plan your meals around vegetables, more plant-based proteins, whole grains, dairy, lean meats, oily fish, nuts, and healthy oils such as olive oil. 2, try to move more. Start with limiting the amount of time spent sitting. Interrupt your sitting time by standing up and moving around briefly every 20 to 30 minutes. Another goal should be to get at least 150 minutes of aerobic exercise per week, like walking, cycling, or jogging. And this is very important now because of the pandemic. I think a lot of people have been sitting. So as a result, there's been a lot of physical inactivity. So there's been concerns about, people gaining weight. And as a result, they fear that, we may end up getting diagnosed with one of these chronic conditions. Number 3, lose weight. And eating an exercise plan that helps you lose just 5% of your initial body weight can delay or prevent type 2 diabetes from developing. Make an action plan and stick with it. Try not to get discouraged if you don't see immediate results. Number 4 is get support. So talk to your healthcare team. Start with changing only one thing at a time. It can be overwhelming to try and change too many things at once, and you're less likely to stick with them. So set goals that are realistic and doable, and over time, any change you make will become part of your everyday routine. So what are some of the risk factors? So for type 1, having a parent or sibling with type 1 diabetes puts you at risk. Researchers suspect that our genes and our environment also play a role, but studies are still underway to understand this better. For type 2, if you're over the age of 40, or if you have a parent, brother, or sister with diabetes, if you belong to one of the ethnic background of being African, Arab, Asian, Hispanic, Indigenous, or South Asian descent, if you belong to low income, experiencing food insecurity, or if you have high blood pressure, high levels of cholesterol, a high BMI, or if you're overweight, especially if that weight is mostly carried around the tummy, if you're pre-diabetic, or if you have polycystic ovarian syndrome, psychiatric disorders such as schizophrenia, depression, bipolar, or obstructive sleep apnea, or if you have darkened patches of skin, or if you belong to the indigenous populations, again, due to their social, systemic, and institutional barriers, it just puts them at a higher risk. For gestational diabetes, if you're over the age of 35 and if you belong to a high-risk group, you can be at risk for gestational diabetes, or if you've been using a corticosteroid medication, or if you've given birth to babies that weigh more than 4 kilograms, or if you're overweight or obese, or you have elevated BMI greater than 30 before pregnancy, or if you're pre-diabetic, if you've been gestational, a diabetic in your previous pregnancies, even if you have a parent, brother, or sister with type 2 diabetes, and again, if you have polycystic ovarian syndrome or darkened patches of skin, all of this will put you at risk to get gestational diabetes as well. What are the causes? Despite popular belief, diabetes is not caused by eating too much sugar, and people don't give themselves diabetes. The cause of diabetes is dependent on your genes, family history, ethnic background, and other factors such as the environment and your health. It also depends on the type of diabetes you develop. In type 1 is an autoimmune disease, or it's also known as insulin-dependent diabetes. So in this case, the body isn't able to produce insulin because the body is attacking its own pancreas. The body's system for fighting infection, your immune system, attacks and destroys the cells in your pancreas that make insulin. As a result, the body is left without insulin. So type 1 diabetes generally develops in childhood or adolescence, but it can also develop in adulthood. People with type 1 need to inject insulin or use an insulin pump to ensure their bodies have the right amount of insulin to regulate the sugar. Roughly 10% of people living with diabetes have type 1 insulin-dependent diabetes. So for type 2, the body can properly use the insulin, also known as insulin resistance, or they cannot produce enough insulin. So when this happens, the sugar in your body, in your blood, is not able to enter the cells where it should get used for energy. It's caused by several factors, such as obesity, ethnic background, family history, and other environmental factors. So people over the age of 40 with family history are at a higher risk of having type 2. And again, your ethnic background is also a risk factor. It's most commonly developed in adulthood, although it can occur in childhood. Lately, we've been seeing a lot of younger kids being diagnosed with type 2 diabetes. It's heavily due to their lifestyle habits and lack of exercise and being overweight. So it can be managed with healthy eating and regular exercise alone, but sometimes you require medications or even insulin therapy when you have type 2. So roughly 90% of the people living with diabetes have type 2 diabetes. Gestational diabetes is a temporary form of diabetes that occurs during pregnancy due to hormone changes. A woman's genes, family history, diet, and exercise habits may also be responsible. In gestational diabetes, the pancreas can't make enough insulin to meet the demand. Between 3 and 20% of the pregnant women develop gestational diabetes, depending on the risk factors. Now, if you have a diagnosis of gestational diabetes, it may increase the risk of developing diabetes later in the life for both mother and child. So pre-diabetes is a condition where blood sugar levels are higher than normal, but they're not high enough to be diagnosed as type 2. So although not everyone with pre-diabetes will develop type 2 diabetes, many people will eventually develop. So it's important to know if you have pre-diabetes because research is showing that some long-term complications associated with diabetes, such as heart disease, may begin during pre-diabetes. So it's also important to know if you are pre-diabetic so that you can take the action sooner. What are some symptoms? So some of the common symptoms are unusual thirst, frequent urination, weight change, it could be a gain or loss, extreme fatigue or lack of energy, blurred vision, frequent or recurrent infections, cuts and bruises that are slow to heal, tingling or numbness in the hands or feet, or if you develop a condition called diabetes ketoacidosis. It's a state where your body becomes very acidotic due to high levels of sugar. So if you or your loved one suspect type 1 diabetes, seek medical attention as soon as possible. These signs could lead to a serious life-threatening situation. Some people diagnosed with type 2 may not really notice any symptoms. How do you manage it? You manage diabetes by taking diabetic medications, including insulin, as well as other medications that are known to protect other organs that can be damaged due to diabetes. You monitor your blood sugar levels regularly using a home blood glucose meter, eating healthy meals and snacks, enjoying regular physical activity, aiming for a healthy body weight, and managing your stress effectively. What are the complications of diabetes? So kidney damage, eye damage, nerve damage, these are the three main classic complications of diabetes that starts early. Heart disease and stroke are rising as well. High blood pressure, amputations, again, due to delayed wound healing. People end up having to amputate their lower legs. Mental health conditions such as depression, anxiety are some of the complications. Now, people with diabetes are 3 times more likely to die of heart disease. Now, when it comes to alcohol, moderate alcohol intake is limited to 2 standard drinks a day or less than 10 drinks a week for women, and up to 3 standard drinks a day or less than 15 drinks a week for men. This recommendation is the same for people without diabetes. So for people with high blood pressure and diabetes, it should be limited to 1 drink a day for women and 2 drinks a day for men. People with type 1 diabetes should be aware that moderate consumption of alcohol with or 2 to 3 hours after an evening meal may result in delayed low blood sugar known as hypoglycemia the next morning after breakfast or up to 24 hours after alcohol consumption. This can also apply to people with type 2 diabetes who are using insulin. Alcohol can affect judgment. They provide empty calories that might lead to weight gain if taken in excess, increase blood pressure and triglycerides, cause damage to liver and nerves, including brain and sexual organs, contribute to inflammation of the pancreas, dehydrate the body, which is very dangerous in someone with high blood sugar, worsen eye disease. So the bottom line is, if you don't drink alcohol, then don't start. If you choose to drink alcohol, intake should be moderate. When drinking alcohol, make sure you know how to prevent and treat low blood sugar. Eat carbohydrate-rich foods when drinking alcohol. Heavy alcohol drinkers are strongly advised to reduce the amount of alcohol they drink. Alcohol use can make blood sugar control more difficult, and it increases other health risks. So hypoglycemia. So what is hypoglycemia? It's when your blood sugar is less than 4. So some people may experience signs and some people may not, which makes it even more dangerous. So some of the signs are sweating, trembling, palpitations, anxiety, hunger, nausea, headache, tingling, disturbed sleep, weird dreams, weakness, difficulty concentrating, vision changes, drowsiness, difficulty speaking, and being unconscious. So why does someone develop low blood sugar? It's either because they've eaten less than planned, they've eaten later than normal, taken more medication than planned, been more active than planned, or they've drunk any alcohol within the past 24 hours. So what do you do when you have hypoglycemia? So you need to eat fast-acting sugar. So that would mean 15 grams of glucose in form of glucose tablets, 1 tablespoon of honey, or 1 tablespoon sugar and water, or 2/3 cup of juice or regular soft drink, or 15 grams fast-acting sugar such as 6 Lifesavers or 2 rolls of rocket candy. Then you wait 15 minutes and you recheck your sugar. So if your next meal is in the next hour and your blood sugar is about 4, then you're good. But if your meal is going to be longer than 1 hour and your sugar is about 4, then just make sure you have a snack. So you can have either crackers and cheese as a snack. But if your sugar is less than 4, you gotta start all over again. Make sure you take another 15 grams of glucose and then go through it until your sugars go above 4. If you're having difficulties, if you make 3 attempts and it's not going up, then you should go to 80. Now, if you're driving, after treating a low, you should wait until your blood sugar is above 6 to start driving. Your brain might need up to 40 minutes to recover before you can safely drive again. So who would be involved in your care team? It could be doctors, NP, specialists, and other people who are supporting you on this journey. So during each visit, it's important that you discuss your blood sugar numbers and diabetes care, discuss your needs and goals, write out any questions you may have, write down information you learned during visits with your diabetes care team. It's important to be on top of things to make sure that your diabetes is well controlled. So there's usually A, B, C, D, E, S of care for diabetes. So during each visit, one thing you gotta check is your A1C under target? It should be less than 7%. Your blood pressure should be within target, less than 130/80. Cholesterol should be under target, less than 2. So you will probably be put on medications to reduce these risk factors. So to control your blood pressure and sugar, your cholesterol, you'll be on those medications. Now, we'll probably have a different session on medications that will be at a later time. That will be organized by Ontario Heroes. The other thing that you need to check during the visit is exercise goals and healthy eating. Again, making sure you have that 150 minutes of moderate to vigorous aerobic activity per week and resistant exercises 2 to 3 times a week. And making sure you follow a healthy dietary pattern such as the Mediterranean diet. You need to screen for complications. So from a cardiac perspective, you need to get an ECG every 3 to 5 years if you're over the age of 40 or if you started having diabetic complications already. You should be checking your foot for sensation. So there's a monofilament test that needs to be done yearly. You check your kidney by checking the renal function and urine to see if that's okay. You repeat it if it's abnormal. And then retinopathy, so your eyes. You need to get a yearly dilated retinal exam to make sure that the diabetes isn't affecting your eyes. Then smoking cessation. So if you're a smoker, then getting counseling and support to help you with quitting. And self-management, stress, and other barriers. So trying to set personalized goals, assess for stress, mental health, any financial or other concerns that might be barriers to getting you that makes it difficult for you to achieve goals in managing your diabetes. So that is where you speak with your family docs or your nurse practitioners or your social workers to help manage the stress and other barriers. Now the next condition, congestive heart failure. So congestive heart failure is a lifelong condition that develops after the heart becomes damaged or weakened. So heart failure occurs when the pumping action of your heart is not strong enough to move the blood around, especially during increased activity or when you're under stress. In addition, the heart muscle may not relax properly to accommodate the flow of blood back from the lungs to the heart. These abnormalities in heart function can cause fluid to back up in your lungs and in other parts of your body, such as your ankles. The congestion in your lungs and lack of oxygen may make you feel tired and short of breath. So sometimes the fluid in your lungs can accumulate to the point where it can cause a life-threatening condition called acute pulmonary edema, requiring emergency treatment. I'm just going to show you a brief video that will be, sometimes visually when you see things will make more sense. So I'm just going to try to share that screen. Yeah, it's just a 2-minute video, so it will be quick.
Heart failure. The heart is a muscle that pumps blood around the body by contracting and relaxing with each heartbeat. In some cases, the muscle has become too weak or stiff to work properly. This could have been caused by a heart attack, other health conditions like high blood pressure, or lifestyle factors. It means the heart can't contract with enough force or fill with enough blood, so less blood is pumped around the body. This can cause problems in other parts of the body, as organs and muscles don't get enough oxygen and nutrition. A common sign is feeling weak and extremely tired. Even normal activities like going for a walk or climbing stairs can be very hard. Some people get short of breath, even when resting. When the kidneys don't get enough blood, they can't do their job properly. So fluid can build up around the body, particularly in feet and ankles. This can be uncomfortable and make putting shoes on a challenge. Fluid in the lungs can make it harder to breathe, especially at night when lying down. So some people sleep on several pillows to help them breathe more easily. There is a need for new treatments for heart failure that reduce the number of costly hospitalizations and improve the quality of life, mortality, and morbidity of these seriously ill patients. For more information, visit www.heartandstroke.ca/heart failure.
So that was just a brief visual video just to understand heart failure, because it is a complex condition. It's not that straightforward. So essentially, your heart is actually a two-sided pump. So the right side of the heart pumps used blood from the body to the lungs. Then in the lungs, your body is loaded up with oxygen, and the left side of the heart pumps the fresh blood full of oxygen from the lungs to the rest of the body. The left side of the heart is usually greater than the right, and that's because it has to pump hard to get the blood out to all parts of your body. So heart failure is when your heart is not pumping as strongly as it should. So it's a pumping failure. So that's why it's called congestive heart failure. It doesn't really mean that your heart is failing and it's going to stop soon. It's just a mechanical issue. So there are two main types of heart failure. One is due to a weak pump. When the heart muscle is weak, it just gets larger and floppy. The second one is a stiff pump. So when the heart muscle cannot relax between beats, between the muscle, because the muscle has become stiff, and the heart cannot properly fill with blood between beats. So what are the causes of heart failure? The most common one is a heart attack. So with a heart attack, it damages that heart muscle and makes it very weak and floppy. So that's the most common reason why we see heart failure in our community. The other common reason is because it's stiff. So that's mainly because of high blood pressure, diabetes, or if you have heart valves that are not working properly by being too narrow or leaky, that can also cause heart failure. And then at that time, it's more of a valve issue rather than a pump issue. Some infection can cause inflammation of the heart muscle called myocarditis. This is something that patients with COVID are experiencing. They go through myocarditis and they end up having heart failure as a result. Excessive use of alcohol or drugs, being obese or overweight, high blood cholesterol, and if you have other type of heart muscle disease of unknown causes or other conditions like thyroid, anemia, or sleep apnea can also cause heart failure. What are the symptoms when you have congestive heart failure? You will notice increased shortness of breath, especially when lying flat, a sudden gain of more than 1.5 kilos or 3 pounds over 1 to 2 days, or 2.5 kilos or 5 pounds in a week, bloating or feeling full all the time, cough or cold symptoms that last for longer than a week, tiredness, loss of energy or extreme tiredness, loss of or change in appetite, increased swelling of the ankles, feet, legs, sacrum, or abdomen, or increased urination at night. And how do you get diagnosed? So there's several tests that need to be done to come to a diagnosis of heart failure. So there are certain blood tests that will check certain enzymes to see if the heart is stressed or if you're actually in heart failure. There's chest x-ray that looks at the size of your heart. So if it's enlarged, oftentimes that's a sign that, there's some issues going on with the heart. And if the lungs look like they're congested, that can let us know that you're experiencing congestive heart failure. ECG to look at the electrical activity of the heart. You may ask to do an exercise stress test to look at how your heart responds to exercise. Nuclear medicine scan gets a close look at the pumping of the heart. Angiogram looks for blockages in your heart arteries. Echocardiogram or ultrasound of the heart looks at the movements of your heart and they measure your ejection fraction. So that will let us know whether you have a weak pump or a stiff pump. So one thing that we're gonna commonly hear for heart failure patients is that they need to limit their salt to less than 2 grams a day. So your body needs some sodium, but not a lot of sodium. So too much sodium can cause your body to hold on to or retain fluid. Then this fluid builds up. It makes your heart work harder. The fluid buildup can cause swelling in your feet, legs, or belly. Fluid can also build up in your lungs, making it hard for you to breathe. So if your weight increases more than 4 pounds over 2 days in a row in 1 week, you're retaining fluid. That's fluid weight that you gained, not the weight from diet, fat. It's not that, it's the water. So if this happens, you should call your healthcare provider right away. So in the average Canadian diet, if you look at where does sodium come from, 77% of it comes from ready-made processed foods and restaurant meals. 12% comes naturally in food, and 11% is from adding the salt to the food and cooking and at the table. So a lot of people, a lot of my patients, very commonly I hear, but I don't add a lot of salt. I don't even add salt. How, why am I gaining fluid? And most likely it's because of their diet that is high in processed foods and restaurant meals. That's where the salt hides, and that's where you go over your salt intake. So how do you avoid salt? You eat fresh foods most of the time and prepare home-cooked, low-sodium meals. Frozen foods are acceptable if they do not have added salt or sodium additives, which are used as preservatives. Remove the salt shaker from the table. Don't add salt, flavored salts, or seasonings high in salt to your food. 1 teaspoon of salt contains 2.3 grams of sodium. So imagine when you have heart failure, you need to limit it to less than 2 grams. So that 1 teaspoon, you're over your salt criteria. So season your food with herbs, spices, lemon juice, dry mustard, and garlic instead. Stay away from eating processed foods, deli meats, pickled foods, salted snack foods such as potato chips, pretzels, dips, and salted nuts. Limit the amount of canned foods you eat and eat out less often. The other thing that patients also have to watch out for is their fluid intake. They need to limit their fluid to 1.5 to 2 liters a day, which is quite difficult if you think about it. 2 liters is easily gone just like that, but they can't have more than 2 liters a day. So any food or drink that is liquid at room temperature will be counted towards your fluid intake. So this includes water, ice, milk, juices, soft drinks, hot drinks, alcohol, soups, gelatin desserts, ice cream, popsicles, and liquid nutrition supplements. You may find you're thirsty to begin with, but as you gradually reduce your fluid intake, your body will adjust. So to keep track of whether your body is holding on to too much fluid, is weigh yourself daily. That will tell you if your body is retaining fluid or not. Tips for reducing your fluid intake: use smaller cups and glasses. Measure the amount of fluid your mugs and glasses hold. They may measure more than 250 mils or 8 ounces. Sip your fluid slowly. Write down the amount you drink each day until limiting your fluid becomes a habit. Drain the fluid from canned fruit. Be aware of foods with high water content like watermelon, yogurt, and pudding. If you can, swallow your pills with soft food like yogurt or porridge. Limit the amount of sodium you eat to 2 grams or less each day. Salt will make you thirsty. Try not to eat sweet foods. They make you thirsty. Try not to drink alcohol. Alcohol dehydrates your body and makes you thirsty as well. So how are patients treated for their heart failure? The key to the treatment is the patient themselves, or you if you have heart failure. So main thing is you need to monitor your symptoms. You need to monitor them because that change in a day for the weight is a key that your body is trying to tell you that something's going on. Or even looking out for signs like tiredness, that swelling, decreased activity tolerance. So these are some of the ways that the body tells you that something's not right. Healthy eating, reduce salt and restricted fluid intake, physical activity and maintaining healthy weight, stopping unhealthy habits such as smoking and alcohol drinking, keeping your blood pressure low, making sure you're taking medications regularly. Sometimes when medications are not sufficient to control symptoms, some people need to go through surgery, such as stenting, bypass surgery, or valve repair. Some people may need device therapy, such as pacemaker, defibrillator, or even a mechanical pump. In severe cases, extreme cases, heart transplantation is the only treatment option available. So if you have heart failure, learning how to live with heart failure is a journey. The main important thing is conserving your energy. So you need to rest at least 1 hour every day. Aim for balance. So balance activity with rest. Balance hard activities with easy activities. Do activities when you feel your best. Plan ahead. Plan your chores and daily activities ahead of time. Space them out throughout the day and week. You do not have to do everything in one day. Whenever you can, sit to work or do daily chores. Keep things you use the most within reach. Prepare bigger meals and freeze portions to save preparing meals another day. Use things that help conserve energy, like choosing clothes that have zippers instead of buttons. Make sure the zipper is in the front and not the back. Use long-handled tools to make reaching easier. If needed, use a walker, shower chair, and bedside toilet. Choose lightweight household or kitchen items, for example, choosing aluminum pots and pans instead of cast iron. Avoid things that drain energy, such as doing chores or activities right after you eat, doing intense physical activity, lifting, stretching, or any other strenuous arm movements. Ask for help. Ask those you live with to share in doing the daily tasks and household chores. Ask family and friends to help out. The other thing is getting enough sleep. So practice good sleep habits. Have a regular bedtime. Relax before bedtime. If you cannot get to sleep within 30 minutes, get up and read or watch TV. Only use your bed for sleeping and intimacy. So this means if you choose to watch TV or read, you need to get out of the bed and do that. If you get short of breath lying down, prop yourself up with pillows. If you get up often to go to the toilet, talk to your healthcare provider. Your medications might need adjusting. And lastly, you take care of your physical health. Keep in contact with your healthcare team. Getting sick can be deadly when you have heart failure. Get a flu shot every year and get a pneumonia shot. And these are some of the reference sources that I use. These are great websites where you can get further information on diabetes and heart failure. So I strongly encourage you guys to go to these websites. If you ever want to look up information, go to websites that are credited rather than just doing a random Google search.
That was actually a wonderful session, Chris. I mean, you have given us insight on both the topics. Almost everything was covered in that.
The most common reason, if you look at the top 5 reasons for admissions at our hospital, is congestive heart failure is one of them, and the other one is diabetes. So that's why it is so important that we try to raise awareness about these topics. And if you know anyone living with these conditions, just encouraging them to taking care of themselves and sharing information on how they can get better or maintain stability. It's heart failure especially. It's a condition that a lot of ups and downs. Like it's not like heart attack. When people have heart attacks, they get their arteries opened and they're fixed and they're good. And then nowadays heart attack is not considered as a hard thing to treat. There's so much medications and technologies that's available. People go in, you've had a heart attack, in 3 to 5 days you're discharged home and then you'll be fine. But a complication of heart attack is heart failure. So there's a subset of group that develop heart failure, and that's when the suffering starts. They just go in and out of the hospital like a revolving door because of the heart failure complications. And oftentimes, the most common reason why people have those up and downs is because either they're not compliant with their medications or they're not compliant with their diet. Mainly the salt and food, they're key to maintaining stability. And so, if you don't follow the recommendations, then medications are not going to be that helpful. Like you're going against what the medications are trying to do, so it becomes even more harder. So then, some people just keep on coming back with more complications. And the more and more flare-ups you have, it's not good for the heart. It's, it weakens the heart further, and you're just increasing your risk for mortality. So that's why it's so important that you keep these conditions optimized. And diabetes, hypertension, these are other conditions. If they're not controlled, then your heart failure won't be controlled either. So very important that you get your underlying risk factors controlled as well, so that you can maintain stability for your heart failure control.
I have Dr. Anu, who's our guest speaker for the day. She's joined us. So I'll just have a brief introduction about Dr. Anu. She obtained her medical degree from the MGR University at Chennai, and subsequently she went to do her residency training in internal medicine from Michigan State University, followed by a fellowship in critical care medicine from the University of Toronto, and a perioperative cardiology fellowship at McMaster University. She holds a certification in adult echocardiography by the American Registry of Diagnostic Cardiac Sonography. Dr. Anu currently works as an intensivist at Gulf General Hospital and an internist at William Osler Health System. She is also an adjunct faculty with McMaster University and Department of Medicine and Hospital Donation Physician with Trillium Gift of Life. I welcome Anu to Ontario Heroes, and there she is. That's a huge lot of degrees associated with you, and we would like to share your knowledge and experiences. We're glad that you are part of this team now.
Thank you for the great introduction. I want to just speak informally about this great endeavor that you guys are taking on at this point. And it's much needed, especially at this time where the world is facing a big challenge and a common enemy, I think. It's a great honor to speak about Ontario Heroes here. I know several members who are part of this team, especially Chris and Praveen, who have been who are very committed and passionate about what they do. Chris and Praveen have been working with the chronic diseases team for over 3 years, and I know them personally. And they have helped numerous individuals and families with amazing resources, education, and treatment options. Chronic diseases, as you know, is a huge burden to the society, and about 80 to 90% of any big national healthcare GDP goes towards, the expenditure goes towards chronic diseases. So if we can make even a small dent in chronic diseases, that's a huge service to the society, in my opinion. Examples of chronic diseases, as I'm sure Chris has already spoken about, includes heart disease, which can be heart attacks, congestive heart failure, stroke, diabetes, cancer, and obesity. Many of these and most of these are preventable. You can delay them. You can keep under very good control with proper effort. They would include healthy eating habits, regular exercise, avoiding smoking, exercising regularly, and avoiding excessive alcohol consumption. Education plays a huge part in preventing and reducing the burden of chronic diseases. Southeast Asians, especially, we have a huge burden of chronic diseases, unfortunately. And in fact, McMaster University here has a separate department focusing on Southeast Asians to see why we are so riddled with chronic diseases. And as you know, India is like a world capital for diabetes at this point. So certainly this team is very good and very experienced in dealing with the management of these issues. Again, I welcome this great endeavor, and best wishes to the team members here.
Thank you, Dr. Anu, for joining into the session and being a part of the team. We really appreciate that. And Chris, you have done a wonderful job. Almost everything has been covered. And before we wind up, I'll just remind you, Ontario Heroes, we have a lot of voluntary activities happening in, so get registered. Go to www.ontarioheroes.ca and register yourself to be a volunteer, be a part of the team. So I wish all of you to stay safe and be healthy, avoid public transport and public places if it is not that necessary. Let's all fight against COVID unitedly. Okay. So thank you, and I'm handing it over to Danny.
Thank you, Dr. Sandeep. It is finally time. I wish everyone a happy Christmas and a happy New Year 2021. COVID-19 numbers are spiking up every day. Stay safe. I would like to welcome Ms. Tania Anto, Director of Programs and Services of Ontario Heroes, for concluding remarks. Over to you, Ms. Tania Anto.
Hi everyone. So thank you Ontario Heroes and the members of the Sierra Leonean community for joining us this evening and taking part in the session. So I hope you all enjoyed the wonderful presentation that was put together by Chris Varughese. Thank you, Chris. I would also like to thank Dr. Ganapthy for joining us this evening and sharing your thoughts and felicitation about Ontario Heroes. And lastly, I would like to thank Dr. Sandeep for moderating this session and also Danilo for doing such an amazing job as being the master of ceremony. And before we conclude the session, I just want to let you all know about the session. It will be held on January 8th and it will be about policing on Ontario. So I hope you all can take part in the session because it will be very informative and engaging. And lastly, I would really appreciate if you all can just give us feedbacks about all the sessions that's been happening. Please share your thoughts and feedbacks in our WhatsApp group or on the website.
Thanks, Chris. That was really good.
Oh, thank you. Do you provide feedback so that, I can know
Absolutely.
what to do next time?
Absolutely.
Oh, wait,